undercorrect the under eye, right? Slightly undercorrect the undercorrect the under eye. Good morning, guys, and welcome to my YouTube channel. Today, I wanted to tell you guys how I would assess a patient's face, and I'll assess my face. So let me hop onto here. I'm so high. Okay. Ooh, okay. So let me kind of show you guys what I would do if you came in and you were a patient and you're like, Joanna, this is what I want to do with my face. And I would take a look at you and just be like, okay, let's see if we can do it. Okay, so pretty much I'm going to show you guys how I mark, things like that, and how I really talk to the patients. So, and I'm going to use myself as a patient. So first things first is, let's pretend that a patient comes in, they're like, okay, Joanna, I have a budget, unlimited budget, which doesn't come often, side note. And for me, I always want to make sure that I go within my patient's budget, just simply because fillers and Botox is expensive. There's no getting around it. It's super, super expensive. I think it's well worth it. However, just keep in mind that a lot of people have to budget for it. I definitely would if I came in as a patient. So just keep that in mind, that I'm very sensitive in terms of what they want to spend. So that's usually one of the first questions I ask, especially if they want to get a lot of things done. So I would say Botox is a really popular procedure, and keep in mind that I'm going to be using my phone and a mirror to kind of draw on myself, and I don't always draw on people, side note. However, I'm going to draw on myself because I have about 20 more minutes until my next patient comes. Okay, so first, Botox. So the most popular areas that people get for Botox include the frown, forehead, and crow's feet. Those three areas are pretty standard. FDA approval, not FDA approval, but the company typically recommends about 50 units, which I usually go by. Some patients can use less, some patients can use more. However, I do typically like to do 50 units. Typically 20 here, 10 per side for the crow's feet. So I'm gonna draw where I typically inject. So right now, ooh, I need some. So I'm gonna do right here, here, here. I don't know if you guys will be able to see the white pen, but I should probably do it a little bit. And then I raise my eyebrows. My eyebrows, my forehead doesn't have that many wrinkles, but if I make a certain movement, it does. So I would probably inject like here, 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 here. The forehead you want to be very careful with, because you don't want to cause ptosis, which is where the eyebrow drops. It can happen, so I always just try to stay clear of that. For the crow's feet, my crow's feet aren't bad. However, I would just go like a little bit here, and I had to tell them to smile really big, like that, really, here, here. Okay, so those are the popular areas that you inject Botox for the frown, forehead, and crow's feet. However, keep in mind that there are other areas to inject Botox as well. Not as common, however, there are some popular areas such as the bunnies. This is the ugliest face I make. Like, it's really unattractive. However, I do have pretty deep bunnies, so you could do a little Botox on the side of the nose, and those are when you get those wrinkles, commonly known as the bunny lines. You can do a few units there, and that really definitely helps. Another part that I really like getting Botox, let me pull them, is my chin. So you can see, it's coming back. So I get chin dimples, and so that's usually, people call it a gummy, an orange peel chin, and it's pretty much when you smile or when you make like that movement, you see how it kind of looks like an orange peel. And so what I would do is I tell them to pucker their lips, pucker, and I'll just inject them. And then usually you want to go just like right there. So that's where I would typically inject. Some people, they need a little bit more than others. Some people, they need a touch up so they can come back for a little bit more. I do a little bit more. Okay, I'm just pretending I'm injecting myself today. Another popular area that people do Botox in is their masseter. And their masseter, obviously, is a pretty big area, and then you have them bite down. So when they bite down, you can't really feel mine right now, but when you bite down, something should pop out. So everyone right now, bite down. Do you feel something? So if you feel something, that typically means that sometimes you grind your teeth, you have a little bit of TMJ, or it can actually slim this. So if you do a little Botox here, you typically do about 50 units, 50 to 60 units, 25 per side. It looks great. I do always warn my patients it takes a little bit longer for you to see the results. However, you can typically feel it in about 2 weeks. So Botox takes about 3 to 10 days on average for the onset of it to start working. However, with the masseter, it does take a little bit longer. So just a little heads up. But so you have them bite down, and then you just kind of inject. Okay. And keep in mind, I'm just doing these markings super duper fast. So just a little heads up. You can also do the neck. I don't really need the neck, ooh, but I do need some neck cream. However, you can do the platysmal bands as well. Okay, let's see where else. Oh yes, you can also do Botox for the gummy smile. You can do a little bit here. You can also do a lip flip. So a lip flip is, not everyone is a candidate for lip flip, just a little heads up. I really regret doing this YouTube video today, side note, because I didn't wear any foundation. I only wore the sunscreen that was a little tinted, so I probably should have worn a little foundation. But anyways, and then you can just inject, and I sharpened this pencil beforehand, and I sharpened it before every patient. Right here. I will warn, the lip flip is a little sensitive. However, for some patients, it really makes a beautiful difference. It's usually when their lips are a little inverted, so there's not as much lip show. Those are the people that are great candidates for Botox lip flips. Perfect. So that is where you do Botox. You can also do Botox in other areas such as sweaty hands, armpits, and all that jazz. However, I'm not going to take off my clothes to show you guys, and also I don't really have sweaty anything. I'm actually very, very dry. But did I do everything? Yes, I think I did everything. Okay, next let's talk about filler. So the most popular area that people do filler, at least for me, is the nose, lips, chin. Those are 3 really popular areas that people do. So for my nose, if you take a look, I have a little bit of the super break right here. So if I wanted to do filler, I would do a little bit here, a little bit on my bridge, a little bit on the tip. I'll be honest though, I do need a little filler right there. But everyone kind of varies. So the average person will come in, they sometimes have a bump or like a lower bridge. So then usually I feel it like right here. So I feel it like right there. And I feel the tip right there. And then sometimes I'll feel right here. So it just kind of depends. And it depends on if you're a candidate or not. So just a little heads up. I didn't know, again, I was filming a YouTube video today. I could have tried to look a little bit cuter, but I don't, but it's okay. Anyways, the next thing people do is their lips. Lips are kind of tried and true. It was one of the first things I've ever done as an injector. It's something that a lot of people get. It's something that a lot of people like, and it's something that a lot of people come back for. So with the lips, it's pretty straightforward. I'm not gonna draw my lips quite simply because I don't even know if it's gonna go on the lips, and I put lip balm on to try to look a little bit better. However, just keep in mind that this, you want to just make sure you do not go outside of the lip border. That's when it can start looking like the filler can migrate. And keep in mind too, if you're doing years of filler, filler can migrate. So just keep that in mind. It is a medical procedure. So I always say, like, people think that their filler and Botox results are going to be perfect. However, they are not perfect all the time. Not even 100%. Sorry, not even 100% of the time. Just keep in mind, because these are all technically medications. So, but they do make you look better for most people. Okay, next is the chin. So the chin filler is one of my favorite areas to inject. I think it makes a beautiful difference, and I think people don't even really realize that they need chin filler necessarily. Like, I am huge on recommending chin filler, and trust me when I say I never recommend things to make more money or anything like that. That is so not me. I can 100% say that. I am not someone to upsell procedures. But if I do feel like someone would really benefit from something, I'll casually ask them, like, can I make you a few more recommendations, or can I make you a different recommendation? And if they say yes, I will let them know in the nicest way possible, you know, because again, this is just an enhancement. I'm not changing your features, I'm just enhancing your features. So I have to be very careful with my wording there. Okay, so with the chin, some people need length, and then so that's typically where you inject and you give length. Some people need projection, and then projection is like right here. So just keep that in mind, length and projection. My chin is not bad. My chin doesn't really need filler, but it definitely needs a lot of Botox. So some people, again, need both. Some people just need the length. Some people just need the projection. So it just kind of depends, again, on what you're looking for. Okay. Another popular area that people do are the cheeks. And the cheeks, I don't usually use this. However, you can measure. So let's see. Okay. You can measure like this. I'm using this as a mirror, so. Okay. And then. Perfect. Okay, so actually, I used my phone as a mirror, so it's not the best drawings. However, I did the same at the tail end to the brows, to the side of my lips, the tracheus, to the side of the nose, and you can see that my face is asymmetrical. My face is real asymmetrical. Actually, every time I replay my YouTube videos, I get so scared because my face is just so asymmetrical. But nobody's face is perfectly symmetrical. And they actually say it's a good thing that your face is not perfectly symmetrical, because if it was, it would look a little bit off too. But just keep in mind that when you do markings, you can see how asymmetrical everyone's face is. Like my nose is crooked, you know, but typically if you want cheek filler, you can do a little bit here, and that is gonna give you that contoured look. And you could do a little bit mid-face too. So those are really popular areas that people like to do cheeks. And it kind of depends on what they need as well. So some people are like, I want that Bella Hadid look or something like that, you know, where they want those beautiful cheekbones. Yes, we can try to achieve them. However, keep in mind that everyone's facial features are different. So fillers can help. However, again, just keep in mind that everyone looks a little bit different. So you can do a little bit here. Some people, they just want that mid-face volume because they have that volume loss with age. So then you can kind of fill in this general area. So that's kind of cheeks right there. But I love getting cheek filler. I think it makes a beautiful difference. It's been a while though. I've been in need of a lot. Next is under eye filler. So under eye filler, I wouldn't do for myself personally because I'm not a candidate. I wouldn't give it to myself. However, I do think there's a lot of people that really greatly benefit from under eye filler. And so with under eye filler, I use a cannula. The cannula is typically about 2 inches long. And so what I'll do is I'll measure it, and let's say this is 2 inches. And then I'll like poke it here, and then use one big needle, not big needle, but a bigger needle than the cannula. And you'll poke it, same thing here, poke it, and the cannula should kind of go like that. And the nice thing about the cannula too is not only does it give you a little bit less downtime on average because it is a blunt tip, it's not breaking through the vessels, so the chance of bruising and swelling is a lot less, but also it can be a little bit safer too because again, it is a blunt tip. However, keep in mind this is a beauty procedure. This is not a beauty procedure, well it is, but it is a medical procedure, so everything does come with its own risk. So I just want to talk about that too. Maybe I'll do a YouTube video on that because I'm trying to upload every single Monday. We'll see how good I am with that. Okay, so anyways, the cannula, and you could just kind of like fan it, and that gives a really soft look. You never want to overdo the under eye because really it looks bad. It's always better to slightly undercorrect the under eye, right? Slightly undercorrect the undercorrect the under eye rather than overcorrect, because when you overcorrect, it can look puffy and it could actually make it look worse. So the under eye is a really, really tricky area. So just a little heads up on that. It takes some sessions to build and to perfect that. So just keep that in mind. Another popular area that I do is the smile lines. So the smile lines are right here. Actually, I love filling my smile lines. I think it looks great, and if you do it conservatively and the right filler, it's gonna look bomb. It just smooths everything out. It makes your makeup just settle in so much better, and I really, really love it. So I like to do a little bit in the cheek and a little bit in the nasolabial fold smile lines. So I think that gives a really pretty, really natural look. So smile lines, under eyes. Okay. Here's also temples. I don't really do temples, but, and I don't really need temples personally. However, there are some patients that need temples. And so what you do is pretty straightforward. You typically use 1 syringe per side, just depending on how much they need. It makes a really beautiful difference though. Another thing is jawline. Let's talk about that. Jawline, to be honest, I'm not a huge fan of, and the reason I say that is simply because in my opinion, and of course everyone's opinion is very, very different. However, in my opinion, sometimes I feel it can make the face look fuller. You have to think to see a good difference, you're gonna be using at least 1 syringe per side. So it makes the face, in my opinion, look a little square and a little bit fuller. In the before and afters, I think it looks great in the photos because it looks that sharper, defined jawline. However, I do think it makes the face sometimes look a little bit fuller. It can look a little messy here. For me, I prefer for there to be really less submental fat, fullness, if that makes any sense. And then, but again, it just, whoever's a candidate. I never knock down procedures necessarily, or I try not to, because I just think that looks a little unprofessional. However, when somebody comes in as a patient and they ask me for my opinion, I will give them my opinion. Okay, where was I? Yes. So jawline. So yes, like if you're, usually males too, they can handle a lot of filler in the jawline area, but sometimes I think females, it can make them look a little bit heavy. But again, this is totally up to the patient. I am not trying to get in trouble by anyone commenting on YouTube, because YouTube kind of scares me, to be honest, because I feel like people come across your videos and a lot of times they don't know who you are. They don't like you, they just literally saw your video, so they'll write like scary things, you know. So YouTube kind of scares me. However, I'm trying to do more YouTube. I don't know, so whatever. Where was I? Yeah, but I think that's pretty much it for my whole face. I'm gonna use some cleansing wipes to wipe my face because I have a patient coming soon. It's funny because I look at my invisible watch here, but I just got a watch, but I don't even look at the time here. So I look at my invisible watch here, but yes, my patient will be coming soon. But yeah, so that video, the nice thing about doing these videos is I don't have to edit it, so I can post it real fast. But I hope you guys really enjoyed that video. I hope that it was informative. I hope that you guys liked it. And thank you guys for watching. This is really just done on a quick whim. You can see that I look now wild. But yeah, that's it. So hope you guys like it. Please subscribe to my YouTube channel if you want more videos every Monday because I really am trying to post every single Monday. So